Hello to everybody again.
Hello.
It's my pleasure to introduce now the people from Indonesia, all the hardworking females from Indonesia. Here we have Professor Nyilo Purnami and Dr. Rosa
Hello.
Falerina from the Dr. Sutomo Hospital, the largest hospital in Surabaya, East Java in Indonesia, and from the hearing clinic of the Airlangaa University of Surabaya, and a resident Indira Prasti. I'm very happy to have you here. I'm very much engaged in the project to implementing a newborn hearing screening in Indonesia, starting with East Java. And so we know each other very, very well. Before we start our interview, please introduce yourself. Nyilo, please start.
Thank you very much, Prof. Katrin, to invite me. I'm from Dr. Sutomo Hospital. I'm working every day in Dr. Sutomo Hospital. And I also working in Faculty of Medicine, Universitas Airlangaa, Surabaya, Indonesia.
And you are an otorhinolaryngologist, a medical professor, right?
Yes,
Hmm?
that's right.
Okay.
Okay.
And we know each other also from WHO, from World Hearing Forum, where Nyilo is
Yes.
also very active. And please, Rosa.
Thank you, Prof. Katrin. Hello, my name is Rosa Falerina. I am otorhinolaryngologist from Surabaya, Indonesia. I'm working at Universitas Airlangaa Hospital, and I'm a lecturer too and researcher in medicine faculty, Universitas Airlangaa. Thank you.
Yes, and Indira is a resident and joins
You're
us.
resident?
Yeah. Do you want to say
Yes.
a word, Indira? Introduce yourself.
Thank you, Prof. Katrin. My name is Indira Prasti. I'm from Universitas Airlangga, Dr. Sutomo Hospital.
Yes, wonderful. So now we start our questions. You know that the topic of this year World Hearing Day is changing mindsets. What does it mean to you? So which misconceptions or stigmatizing ways of thinking in your country are you aware of where we have to change mindsets? Do you want to start, Nyilo?
Okay. So I'll try to talk about changing mindset. This is, I think, is very important because we start from how the way we think. Yeah. So the people with hearing loss usually have stigmatized, like being old and cognitively diminished, and poor communication partners, and generally looks uninteresting. Yeah. And the hearing aid user usually labeled as it's different with others and like weird to use the hearing aids, and also a kind of not cool, and uh, being looks older, yeah, than her age. So that's seems in the Indonesia hearing aid user.
Yeah, this happens everywhere in the world. We all
Yeah.
wear our glasses. However, nobody
Yes.
thinks, maybe children think that we are looking
Yeah.
old. I don't know. When my grandmother wore glasses, I always thought, yes, this is what old people are doing, but we think it doesn't disturb anybody. But for the hearing aids, it's a worldwide misconception. That's right. Rosa, do you
Yes.
still have an idea, or Indira?
Uh, Yes, I have a little bit another opinion. I agree with the Prof. Nyilo, but I think right now in Indonesia, one of the misperception is in the early hearing screening for newborn baby is still for the high-risk baby only. So there is a very big chance to us we can lose many hearing loss cases without any risk in this baby. We found the hearing loss cases maybe in Indonesia at age 2 or 3 years old, more than that. And the stigma after that, if they diagnosed with the hearing loss, they need to use the hearing device and usually should go to the school, especially for the deaf one. Yeah, there's a very
Yeah, so we really need to change this situation. You lose about the half of babies if you do only an at-risk screening and not a universal screening. That's true. Yeah. So what awareness raising or information sharing activities do you think are needed to change really the mindsets for the professionals in Indonesia?
Yeah,
yeah,
this is important issue. Yeah, that raising awareness. Yeah, we should do for the community and also information sharing. So usually we do education, educate the people while we do counseling. Yeah, and also to have the symposium, like talking in some workshop, and also using popular social media such Facebook, Instagram, and like WhatsApp and others. Yeah,
I
I
need to
think this
mention,
is effective. Yeah,
absolutely.
this is effective. Yeah.
I want to mention that the last year, World Hearing Day, the most activities which were registered at WHO, 40% of activities came from Indonesia. I was really astonished. So you are doing a lot. Rosa, do you still have a contribution, or Indira?
Yes, we have like a ORL HNS organization, the local one, and every 2 or 3 times every year we held the free program for clean up the ear. And at the primary, junior, and senior high school, or maybe another place. And usually we combine it with the free counseling for the hearing program. So we can reach out more hearing loss cases if we found it for the intervention.
Yeah. Indira, do you want to mention something?
I think most of the activities already described by my professor, including the charity event and social event.
Yeah.
Thank you.
I was astonished last year when I was in Indonesia, and I've seen the outreach of activities which have which focus on ear cleaning. I was really astonished because in the World Report on Hearing we wrote that of the WHO that earwax cerumen is a normal secretion of the ear, and usually the ears need not to be cleaned. Only in exceptional cases, for instance, if people are wearing hearing aids, or at old ages, or for people with some syndromes, craniofacial syndromes, or intellectual disability, earwax establishes a main problem. But I guess there's only a very, very small minority of people which really need a regular ear cleaning. So isn't this also a misconception? What do you think?
Okay, I'll try to give comment that the hearing problem, it's one is the cerumen, wax, cerumen obstruans. So usually we do like the outreach services in to examine the student in that school, and just surprise. Usually we find, we found, uh, we observe the settlement is happening around 50% in the students, among the students. It's quite high. So sometimes the wax is not is the student are not complained, and also maybe the parents also, they don't realize that they have they reduce the hearing because of the obstruction of the cerumen. So that's why we need to examine the student, usually primary health health center. They examine also the student regularly. And while doing the cerumen extraction and also cleaning the wax, if it is mostly obstruction, and then we can educate. Yeah, we approach the parents about the ear and hearing care for the parents, and also in the community. It's kind of the strategy to educate the people. That's my comment. Yeah, that's
Well,
interesting.
yeah,
Maybe
if it is a good
we have
way
high incidence.
if it is a good way to reach people and to approach people, then I can understand it. But otherwise, Indonesia would be a very big exception, because there is no surprise that there's earwax in the ear, because the ear produces earwax regularly, and it has its physiological function, and the completely blocking earwax is not as frequent.
Actually, it's not.
Maybe
It's not regularly.
Yeah.
So so usually we do the cleaning wax just only for cerumen obstruction.
Okay.
So we examine, so we see the ear canal. If it's obstruction, there were cerumen obstruction, and then we clean it. But if not, so just only see, not
Okay.
doing something.
Okay, Rosa,
And
what do you think, which external partners outside of our professional community we need to reach to make the problem of ear and hearing care, or ear and hearing health, more known among the public and for politicians, for example?
Yeah, I think the first one is our local government in Surabaya, East Java. What we have done, we usually invite them to our occasion, like a symposium, then lead to the hearing problem. So they will more concerned about it. They will know more data that we have collect every year. And we can do the discussion regularly about the hearing problem. And then what kind of tools that we need, what kind of tools that was broken. So we can discuss about the solution about that. We can help more people to prevent the hearing problem. We can more help them to intervention. So yeah, we usually do the cooperation with the local government. We invite them to our hospital, to our research center, so they can observe directly.
Very
Yes.
good. Very good. And a question to all of you, what does changing mindset with respect to ear and hearing health mean to you personally? Do you see a personal contribution, or do you have something in mind, such as, I would say, what for me is particular interesting is how well can I understand on central stations or at airports, or also if there are calls by loudspeakers and I don't understand it. I always imagine, if I don't understand it, how will people who are older or who have hearing loss understand it? And so this is an interesting aspect to me, which I would bring to the mind of people. What are your personal approaches? Nyilo, want to start?
Yeah. I think changing mindset is very important. So because we need to change from the myth to the reality. So like the common people usually believe about the myths, and we need to educate the people that the reality, how we need to do. Yeah. What a must to do about the hearing care and also about the hearing loss. So we need to educate the people, and to affecting the way they think. Yeah, and also because sometimes the complaint or the symptom, yeah, is not so clear. So we need to explain more for the people about ear and hearing care.
Yes.
Yeah, because the hearing loss is invisible, like the hidden handicap.
Yes, absolutely right. And Rosa?
Yes, thank you. Changing mindset is very important for me. If we all have the same mindset in hearing problem, we can start together to do the hearing screening as soon as possible, so we can do the intervention. So it will increase the quality of life for better ear and better life. I think
Good,
that's
very good. And Indira, as a young person, do you have another idea or contribution?
During my time as a doctor in the primary healthcare facility, we do screening for the elementary school student, and sadly, when we found that they have ear disease, usually they do not want to come to the healthcare facility because the parents and the family of the child is still believing that it's not a big problem, or they are scared. So it will hinder the treatment and rehabilitation process. If we can persuade the healthcare provider and the parent, I think it's better for the child, the treatment for the child. Thank you.
Thank you so much for sharing this with all of us, and have a nice World Hearing Day.
Thank you.